Welcome to today's webinar entitled One Health Policy, Governance, and the EID NTD Interface. This webinar is part of a series entitled Reconnecting for Our Future, hosted by the Lancet One Health Commission. I'm Renzo Ginto, Director of the Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines and the Commission's Next Generation Advisor, and I will serve as today's moderator. This webinar series is organized by the Center for Global Health at the University of Oslo, together with the Kumasi Center for Collaborative Research in Tropical Medicine in Ghana and the Center for Global Health at the Technical University of Munich. Before we start, I just want to make sure that you are aware of a couple of things. When you registered, you agreed to the session being recorded. The link will later be made available to those not being able to attend. All participants' microphones and videos will remain inactive throughout the session. This 1-hour webinar will begin with an initial round of opening remarks from our panelists, to be followed by a Q&A session. So to our participants, you're invited to type in your questions, either with your name or anonymously using the Q&A button, and I will be reading them to our panelists. Today, we have almost 200 participants from around the world registered, and we are also joined by several expert members of the Lancet One Health Commission. Welcome to you all. So if you joined us in the previous webinars organized by the Lancet One Health Commission, you will remember that we examined One Health as an arena for education, capacity building, and scientific inquiry. Today, we will be exploring the concept of One Health governance, and particularly discussing lessons from neglected tropical disease or NTD control and other integrated health approaches, and how could they be scaled to address emerging infectious diseases or EID and related issues at the human-animal ecosystem interface. What does good governance look like in the One Health space? Why is thinking about policy and governance important? So these questions will be answered by our esteemed panel, who are all commissioners of the Lancet One Health Commission. And let me just introduce them very briefly. I will not read their amazing bios, which you can access in the website of the University of Oslo. First, we have Professor Eric Favre, who is the Professor of Veterinary Infectious Diseases at the Institute of Infection and Global Health, or IGH, at the University of Liverpool, and is jointly based at the International Livestock Research Institute in Nairobi, Kenya. We have also Dr. Bernadette Abella Ritter. She works in the Department for the Control of Neglected Tropical Diseases, or NTDs, of the World Health Organization as team leader on neglected zoonotic diseases and NTDs that have a human-animal interface. And finally, last but not the least, we have Dr. Anna Okello. She is the Research Program Manager for Livestock Systems at the Australian Centre for International Agricultural Research, which is a statutory authority within the Australian government's foreign aid portfolio. Eric, Bernadette, Anna, welcome to our panel. So let's start the ball rolling, and I'll ask you a broad question, and feel free to answer it from where you stand or where you sit. Now in the time of Zoom, everyone is sitting while convening, and so my question is, why is thinking about governance or the policy aspects of One Health so important, especially in this day and age? And let's start with Eric.
Thank you, Renzo. Good afternoon, or good morning, or good evening, wherever you are, to everyone, and thanks again for the invitation to take part in this. I guess I would start in answering that question by first really going back to some definitions and trying to understand what governance and good governance really mean. So I looked up some definitions, and the UN has some definitions for these things. And governance is really the process of decision making and the process by which decisions are then implemented once they've been made, or indeed not implemented once a decision to not implement something has been made. Governance, it can be used in many contexts, of course, national governments, of course, the way a country is governed, corporate governance for companies, the governance of international issues by international organizations such as the United Nations, or local governance by local institutions, either that represent the state or indeed that are non-state actors in many of these things. And I think it's also important to remember that governance is also something that can be undertaken by informal groups. So there are powerful people, powerful groups of people who determine the way that things are done, and that has a big impact. And good governance, of course, is knowing who's how to do things equitably and representing all voices in a way that is transparent. And so within One Health, this is very important because we need to think about, in One Health, we're often trying to do multidisciplinary or indeed interdisciplinary things, and we're taking approaches that integrate across a multitude of different individuals and organizations. And that all leads to one combined, unified approach. And it's not always, it doesn't necessarily come naturally to individuals or their institutions to do this. And so we need to think about how we fit individuals and institutions together to best deliver what we want to do under the One Health banner. And so planning that carefully and ensuring everyone is well represented is a really important part of the process. There we are.
Thanks so much, Eric, for laying out a broad picture of governance. What I'm hearing from you is governance is not about government alone. You mentioned the role of the corporate sector and also informal groups. And also you mentioned international governance, and that's why I would also like to pose the same question to Bernadette. What is the view from Geneva, from the World Health Organization, when you think about governance and One Health, especially at the international level? Please.
Thank you very much, Renzo, and thanks a lot for inviting me to be on this panel. It's always very interesting to get the different aspects, and I'll build without repeating on Eric's intervention currently. So from the international point of view, I guess our role is really convening and channeling the aspects of One Health and its contribution to global public health. And I think in the view of coronavirus that has really changed the world, that started with a One Health risk, so to speak, that was not contained at source immediately, has really impacted us in every way possible. And we see how there was a call for improved governance around the decision making, the guidance for countries to follow, the data to come together so that we can understand what is happening, to understand the epidemiology and make the best use for that to respond to this emerging threat that we have. And so one really nice example, and I won't go into the details of how it is the COVAX, the collaboration, the coming together of multiple agencies to look at a provision of vaccines in an equitable angle. And so I'm sitting in the neglected tropical diseases department and giving you, I will give you my sort of angle from NTDs. And we are really targeting the assuring of equity, the human rights to access health and health services in the most efficient way, and targeting the most disadvantaged of society. And with that, in fact, you can have a look at the recently endorsed WHO Neglected Tropical Diseases Roadmap for 2021 to 2030. That really is taking a look at how we can build a more sustainable how we can build more sustainable programs in neglected tropical diseases. And when we think about One Health and the effect of, for example, environment and animals and food, and the impact on the individual diseases. As you know, the neglected tropical diseases encompass 20 or so diseases, but for example, WASH has a big impact on the neglected tropical diseases, and so does One Health. And so I think one of the sort of new angles of our roadmap is trying to see how we can have better processes around decision making that include that multi-dimensional stakeholdership. It is a multi-dimensional challenge in that way, that we are trying to put together our efforts that are mutually reinforcing to effectively address the drivers of and responding to the risks at this interface of humans, animals, and the environment that we all share. And so in a sense, I see this in a very simple way, bringing together the different partners, and it's public, civil society, and private sector, so that we align and coordinate our work to achieve overall goals and milestones. And basically, our end goal is to have an impact on improved health of our people, but also of our environment that we all share, and the animals that we interface with. And so again, building from Eric, it's really about also from the angle of international organizations where our members, our member states, our countries, looking at better country governance, ownership, building the political will to commit to the management and delivery of those programs, and to also look more at the accountability, that each stakeholder has responsibilities and are accountable for those actions, so that we have better planning, better implementation, and safe administration of whatever actions we are taking, whether it's treatment in humans or animals. And then, of course, a really important aspect is monitoring of the progress. The data has a whole governance structure to itself, so that data is really, really key in all of this. So I think one area I would like to just finish off with is, already we have a very strong relationship with our colleagues from the Food and Agricultural Organization of the United Nations and the World Organization for Animal Health, that builds a core group of international bodies working with their membership to look at improved governance on One Health. And we will be working more closely also with UNEP. And in fact, there was recently at the Paris Peace Conference a launch of a high-level council on One Health that will start to take action to serve as an advisory body on issues of One Health and the risks to our society. If we take better care, action, are more proactive, we can reduce the impact of these negative happenings. Thank you.
Thank you, Bernadette. And that's quite a treasure trove of very important ideas and concepts. Of course, when we talk about One Health and One Health governance, the first thing that comes to mind is the multi-stakeholder or multi-sectoral approach. Bringing in animal, human, and the environmental health sectors. But some ideas that are quite new to me, hearing it from you. For instance, you mentioned the phrase human rights, which does not always show up in One Health conversations. And so maybe later we'll talk about the importance of human rights and how One Health, for instance, can actually be another approach to the achievement of human rights, in particular the right to health. And also, you gave some examples. Is COVAX a form of One Health governance at work? And what other forms or mechanisms can we actually build at the global level as we confront more One Health risks? That's another term or phrase that you introduced. in your remarks. So maybe now it's the coronavirus, but tomorrow it's another pathogen at the human-animal environment interface. Now I will move to Anna, and I know Anna. It's already night in Australia. It's almost night here in the Philippines. And we're passionate, and that's why we're still part of this conversation. From your perspective, what does governance mean, and specifically, as it relates to the work that you do in your organization? Please, Anna.
Thank you so much, Renzo, and thank you for having me. And good morning, good afternoon, good evening to all our listeners, particularly my fellow Australians or New Zealanders or Philippine friends that are also on this side of the world. So governance, it's a really interesting, fascinating theme, I think, and really presents itself in so many different facets. And as sort of Eric and Bernadette have touched on, there's so many different types of governance. There's so many levels at which governance happens, informal mechanisms, formal. I guess from the perspective of the role that I have now, which is working in a public research funding agency, governance really is threaded through everything that we do, because I guess Eric touched on a really important point about what good governance is, representing all voices in a way that is transparent. And if you think around particularly policy and bridging this research policy interface, which is something that the Australian Centre for International Ag Research really thinks about. If we don't fund and design research programs that, provide that equal representation of all men, women, youth, urban, rural, different types of socioeconomic sort of demographics, then the research results that come out of this will not be representative. And if we feed, if we're bridging that research policy interface, which is, the end game of a lot of research, regardless of the funders, you want to do research that eventually will move into policy and make recommendations for policy. If we don't have an equitable, well-governed approach to the way we do research, then, that won't follow through into good governance in terms of policies and programmatic operationalization and that sort of thing. So I think that's a really important point. And, from a research perspective, I've touched on good governance in research, what types of research, I guess, and particularly now, ACR's always had quite a strong One Health theme through a lot of the research programs. We work, food security is our key mandate. We work in agri-food systems. So really, if you think of agri-food systems as this interface between environmental and agriculture and humans and human health and nutrition, then it makes sense for us to be thinking a lot about One Health in ACR. So I think, in terms of the types of research that will eventually lead to this research policy, bridging of that research policy interface, there's no doubt there's still a lot of research that's required around, really these biophysical aspects. So risk factors, risk mitigation, how risks of particularly, for example, zoonotic diseases impact different groups of people differently. How we think of risks to women, for example, are often quite different when you just think of even straight zoonotic diseases. This is another area, the neglected tropical disease research, collaboration across the globe is really good at thinking about these types of things. So I think it's one really good example where we can apply results of NTD research in the way we think about neglected tropical disease control and understanding risk to more emerging infectious diseases as well. Same goes for food safety and all these different types of things. And so, I think there's definitely a big body of research that, we can always, think of better understanding these risk factors and stuff. But, moving forwards from that, particularly again, when we're talking about policy governance, I really think there's a large body of research that's probably not as being done as much to date or being thought about as much. And this really is more around these social science research, economic research, political science, these types of are the types of research that really will help in that bridging that research policy interface. We want things like governance and policy research to help identify mechanisms for cross-sectoral policy approaches to One Health, for example. How are policy decisions made? Who makes those decisions? How is funding allocated so it can be shared jointly across, for example, the Ministries of Health and Agriculture? I think there's a lot of these types of research questions that really involve a more social or political science angle that I think we would help move One Health along. Obviously, a lot more social science. I'm a big advocate for more social science, and to understand, it really sits, it absolutely has to sit alongside any type of biophysical research we do around risk and risk factors. Again, it's another area that the neglected tropical disease community is really, really good at thinking, okay, we have interventions, what is the social science around those interventions? And I think the same, we could be doing more in the One Health space on social research. And really importantly also, the economics of the cost of One Health, much more research required around how do we understand, the cost savings to ministries of health, for example, as a result of, investing better in our agri-food systems, and what are the cost savings, what are the trade-offs, how do we even do, One Health economics? So I think, that's sort of my thinking around how do we get a bit better balance between really the biophysical stuff and the risk and the pandemic preparedness and all these big questions around how diseases actually spread. It's very, very important. But when you're trying to mitigate the risk of disease spread, you do have to put that social lens on it and that economic lens. And we always need to be thinking about what's the next step, what's the end game of this research, where is it leading, and how are we going to bridge that research policy interface.
Thank you, Anna. And we love the social sciences. We need more of the social sciences in One Health in trying to study these biological threats to health. And we can only really truly answer, I think, the question of what is good governance if we do more social science research about it, right? And so I hope that funders, for instance, will actually invest more, for instance, in social science research projects in One Health. And let's stop treating social science, I guess, as, an icing on the cake. And that's, I think, what I've been seeing. There's a bit of anthropology or political science when in fact, it could actually be the main research question. But I think there's also, it takes two to tango. We need more researchers who will be bold and daring and willing to look into these questions, but also funders and governments who are interested in trying to find out the answer. And that means putting the money where their mouth is. So thanks to all of your initial remarks. And I would like to encourage our participants to use a chat box or the Q&A section of the Zoom platform to ask your questions or even give your comments. I'll read them to our panelists later. But while I'm waiting for your questions, let me just do a quick round of follow-up questions, because all of your remarks, again, have been very prolific and full of wisdom. I'll go back to Eric, and you talk about the different spaces where governance for One Health does manifest, local to global, the more formal structures. But I was intrigued when you said corporate governance, and we know that in a lot of One Health threats are also shaped and driven by corporations, by the business sector, whether they help mitigate them or they actually help or aid in driving them. And transnational corporations are also quite critical, again, in the generation of these One Health threats. How can we actually improve corporate governance in the business sector so that they become our allies in One Health risk reduction and health promotion? Do you have any ideas on that? Thanks.
So yes, thanks. I think actually already that is happening. I want to draw on an example. I mean, we're discussing the NTDs specifically in this webinar. And actually an NTD that I no longer really work on very directly, but that I spent a lot of time working on is human African trypanosomiasis. And in that example, where there are governance structures at multiple different levels that have come together to really have massive impacts on this disease, where a few decades ago we were talking about tens of thousands of people affected. And within a short time we were moving to thousands of people, then hundreds of people, and now in some countries, tens of people only who are affected by this because of tremendous efforts that have been put in place, spearheaded by WHO in particular, but also with other parts of the tripartite organizations in doing that. And that has strongly involved the corporate sector, who have been brought in to manufacture and distribute free of charge in many cases the drugs that are required to control a disease like that, with then public sector perhaps taking up the responsibility of the costs of distribution, working with national governments. But the corporate sector is already, in that example, a wonderful ally in bringing the technology and the tools that are necessary to control disease in poor, neglected populations that you wouldn't think the corporate sector would normally care about because they're not really clients for any other product. But they are key organizations in that whole fight against that disease. And it would have been impossible to make those enormous strides in the absence of that collaboration with the corporate sector. So there are examples which I'm sure we could find of where the corporate sector isn't behaving particularly well and where that has negative effects. But in these examples, with good global level governance from organizations like WHO, national level governance from governments, but also lots of other non-governmental organizations, bringing in the corporate sector to really have a very, very positive impact indeed. So I prefer to use a positive example rather than a negative one to highlight that particular issue. Thanks.
Thanks, Eric. And of course, that's a follow-up question to your opening remarks. But if Anna and Bernadette also would like to jump in while we're still in the issue of the role of corporations in One Health and how we can better govern or regulate their activities. Is that Anna? Is that a signal? Do you want to say something, please?
Oh no, I was playing with my pen, but I mean, I think just to follow on what Eric said. I mean, if you think of any system, and this is this systems-based approach, which is what we need to take when we're trying to address these really complex One Health type issues. Any system is going to have what we call public goods and what we call private goods. And think of any disease. I mean, human African trips is a great example. There's lots of examples of neglected tropical diseases that you are going to have the corporate sectors working together with the public services, the public veterinary services, for example, public hospitals, and the private goods aspects, the drug delivery, services and all these sorts of things. They have to go hand in hand to strengthen that whole public veterinary system or public health system. So I think the question of corporations, I mean, we can't ignore it. And there are numerous examples in the NTDs where public-private partnerships have worked really well. And I think it would be great if we had more time to dig into some of this stuff. But I think it is just recognising that there are, what are the public veterinary services and the public health services that need strengthening? What are the private areas where the private sector can complement that and help us strengthen that and find where those commonalities are, because that is what's going to lead to sustainability of these approaches long term.
Thank you, Anna. And then sure, maybe that's another webinar in this series on the role of the private sector and corporations in improving One Health in this century. I'll go now to Bernadette, and as I've said a while ago, you raised some really important principles when it comes to One Health governance, multisectoriality, human rights. You mentioned about political will, and my question is COVID-19 now is at the top of everyone's minds, and I wonder if COVID has opened a window for more or a greater buy-in, for instance, for investing in One Health activities, embedding One Health in governance at all levels. So what are you seeing now? And how can we even expand or widen that window even further? Bernadette.
So yes, I think COVID has brought more attention to the subject of the human-animal environmental interface, especially around food systems. I always do think that often a catastrophe is what brings the attention to a certain subject. And the worry is that then in peacetime, things start to go quiet, no longer headlines to keep people motivated. And so I see the building of a systematic attention towards One Health, rather than just always looking at the epidemic risks and impacts. We should be trying to see this as building the systems for which communities have a stake in and are interested in and know. And I'll take up a subject that I work on, not a livestock disease, not a food on most places, not rabies. You know, it's a dog, falls between the system of livestock, the ministries of health. Nobody feels responsible. So I think looking at systems that address diseases in communities or risks in communities, doesn't have to be a zoonotic disease, and trying to address them beyond just that epidemic scare that we have currently. So we need to maintain that and really engage now more forcefully in the discussions, not only at a technical level and a community level, but also really very much at a political and high political level, so that we keep the momentum going beyond the epidemic. And just coming back then to the human rights of this, it allows us as a community, a large community, to work towards more equitable access to health on the long term, so that we are, and this is part of our UN Charter, the WHO Charter, looking that we go beyond it doesn't matter what gender or race or religion or wherever you sit in the world, what social status you have or economic status, everybody has a right to live a healthy life, to have good well-being and have access to services. And just one last thing, to just come back onto the corporate participation in the improvement of health of humans, animals, and the environment, is that without the tools that the corporate environment provides, we would be poor. So we need each other to make this place a better world. And I do see a lot more sort of corporate social responsibility often coming from the human pharmaceutical sector. And I think there's a lot of space still to be thinking, how can the agri-food industry, how can the animal pharmaceutical industry provide more support on the global good front, repurposing of some of their products to service the less the disadvantaged populations, so that we are really contributing to those sustainable development goals that we are all really intent of to achieving it by 2030. I hope that answers your question.
And more than actually, and I think when it comes to, again, it seems that the corporate governance aspect has been a very interesting topic here. It's striking this balance, on one hand, being able to engage with them and tap on their capabilities to address these shared One Health challenges, but on the other hand, how can we make them, let's say, destroy less the environment, or pollute less, so that One Health problems are actually prevented in the first place. And you also talk about the importance of human rights. I think that's a space where there's still very little conversation, at least from where I stand, how human rights instruments can actually be capitalized to advance One Health goals, again, at the nexus of human, animal, and environmental interface. And we actually have a question, and I'll just insert this question before I go to Anna's follow-up question from Farah. She has a question: what role has the rights of animals in the One Health conversation have? in governance, because we tend to be very anthropocentric, right? Oh, it's all about human rights. But I think in the legal space, there's also this emerging discourse around the rights of animals. And so is there an opportunity for convergence there, which is in the very spirit of One Health? Bernadette, please.
And there is. I mean, the work we do should not be only about a certain disease. So if we're working on rabies, we're also looking at better dog ownership. What does it mean to have better dog ownership, welfare, and on the food system side, improved welfare for animals definitely is part of the whole thinking around One Health. It's not only about improving one side and not the other. It's a huge piece of work, and that's why we do need our partners to help us address the different aspects. But definitely welfare of animals is part of the equation.
Thanks, Bernadette. Now I'll proceed to Anna, and you raised about the importance of the social sciences, and we actually have several questions here. One is from my friend Godelie Van Heteren. She's challenging what I said. Social sciences are no longer treated as icing on the cake, but there is still a lot of insularity in the way we approach this. So she's saying there's a lot of attention to social science, but this requires specific non-insular ways of social scientists to engage with others as well. So I wonder if you're already seeing that breaking of the silos even in the social science space. And actually, we were also discussing the One Health Commission. We might want to have another session on the role of the social science says. And there's also another comment from John Connolly. He is a social scientist working in the One Health space, and he agrees that social science should not be placed on the margins. His question is, what is the main role of the social sciences in promoting One Health-based regulations and policies in the future? So maybe you can be also more specific examples of how social science insights actually strengthen One Health regulation, maybe even in the agriculture food sector as well. Please, Anna.
Thanks, Renzo. So just on the first question on the challenge, I mean, I'd have to agree with that comment. I think certainly in the last almost 15 years that I've been working in this space, I'm certainly seeing, the voices of, or the understanding and the recognition of the role of social science becoming much, much more prominent compared to, when we first started this, a while ago. There's the comment around insularity. I mean, for me, I guess one of the things I see, and this comes from me starting off as a very quantitative scientist, a veterinarian, epidemiology, spinning round into a political science PhD, and just even more evidence. What does evidence look like when you're a social scientist compared to an epidemiologist, for example? And I think there's certainly, more dialogue and more conversations, and we're seeing more and more of those types where you're getting, quantitative and qualitative science and these mixed method approaches moving together. So I think, things are definitely moving in the right direction. And as I say, we at ACR, we have a whole social science research program. So look that up and see some of the work they're doing in that program. So on the second question, I mean, this is something, very, very, I think it's a really exciting space. I think there's definitely a role for social science in all its forms, policy, process analysis, these more sort of almost political science ways of thinking around how do we better operationalize One Health. I think there's sort of an assumption that gets challenged that policy is this rational linear process. As researchers, and I was a researcher, we think of research as a problem to be fixed. And then we go and we do the research and we get the answer, and then we package that up, give it to the policymaker or the decision maker in the community, whichever your target beneficiary is, and that's our job done. But I think really the role for social scientists is all the work they do on the ground, understanding gender, equity, how different people think, different perception of risk. All of that space is really done very well, and there's a lot of research and a lot of funding that goes into community development approaches to research, I guess. The area that I think we should be doing a little bit more of and thinking a bit more about is applying those investigative methods, I guess, that we use in participatory action research and all that type of stuff with communities, applying that to actually policymakers and better understanding, this whole area of policy process analysis, and really better understanding when we say policymaker or decision maker, whether it's at a community level or a local government level or right up, even at a donor level, who are those decision makers, and what evidence do they need, or what information do they need to be able to make those decisions? And I think unless we're asking those questions, who makes the decisions in whatever environment you're working in or whatever research question you're thinking about, who has the capacity to, move something forwards or block something, for example, who are the gatekeepers, who are the champions, all these types of questions. I think that's a really, as a social scientist working in the One Health space, I would love to see more of that sort of, applying those social research concepts and methods to the decision makers themselves, regardless of what level that occurs at.
Thank you so much, Anna. And I just want to acknowledge that the Lancet One Health Commission has several social scientists or commissioners with a social science background. And I'll not be surprised if there will be a very strong emphasis on the role of the social sciences in the report that will be released next year. Eric, you have something to add on the issue around social sciences' role in One Health.
Yes, just two things I wanted to say. The first is, at the beginning, I said that good governance is about representing people's views and responding to that in part. And the only way that we can understand what people's views are is to deploy social science methodologies to gather information about those views. So it's impossible to do One Health without the heavy involvement of social science disciplines, so that we can understand the people that we are dealing with as our clients, if we want to put it that way. And so understanding their perspectives, it's essential to take those social science approaches, creative as they need to be. The other thing I wanted to say is that when we're doing research, I think it's really important that social science is not integrated into the research we do simply by saying, oh yes, I need to do a quick survey, or I'd like to do a focus group discussion. Let me phone up my favorite social scientist and get them to design me a questionnaire. That's not involving social scientists. That's sort of somewhat exploitative, and it's really missing the point, I think. What we need is to involve, so I'm a natural scientist, but so we need to involve our social science colleagues in that process of the research from the very beginning, and also create opportunities within the research that we do so that the social science disciplines can also develop their own methodologies within that process. It's not all about improving the way we do biology with a bit of tokenistic social science thrown in. We need the social scientists to really have a stake and to be developing their own tools, their own methods, their own thinking through that research. Thanks.
Thanks so much, Eric. So now I'll shift gears, and one of the topics also that Anna and the others have also raised is the importance of communities. And Anna was asking, who gets to make the decisions? Who gets to say what is or even define the research question? And oftentimes the communities are not are not being included in the process, or at least if they're included in a very tokenistic manner, as Eric was also describing some approaches we have in including the social sciences. There's a question from Juan Lubroth, who's actually also a member of the Lancet One Health Commission. He was saying, and I'll just read it: community health workers, including community animal health workers, are paid by the communities for their services. Administering medicines for their small profit may exacerbate challenges on AMR, antimicrobial resistance. So he's also raising another issue at the animal-human environment interface. How would our speakers address good governance under this prevailing issue? So what I'm also getting is, maybe we can spend a couple of minutes talking about the role of communities and making sure that One Health governance is not a top-down process, but truly, participatory and transparent and inclusive, as some of you also have already mentioned a while ago. Maybe you can also give some examples of effective local engagement in One Health. Who would like to start? Bernadette.
Yes. So I mean, I do think there is a need for a sort of a top down. So you do need regulation from governments to have a framework to work with. So for antimicrobial use, for example, there needs to be some regulation about uses and for it. But of course, it's a double-edged sword. It's an income, it's a source for many, for many people, and so again, this might be an area for not only social research but research in general. How do you replace that source with something that that is not harmful? And building, for example, antimicrobial resistance. And I think we can't, this doesn't, we have to also not only work with tools like regulation, but also build that awareness in the communities about, because antimicrobial resistance is not visible, right? You see rabies, you see pox, you see skin diseases, it's visible. But with antimicrobial resistance, it is not. And so there needs to be a better understanding, not only in communities, but also in healthcare workers and in the health systems about the use, more prudent use of antimicrobials. And so there's still much to be done to build awareness, find alternative resources of income, and trying to build, improved agricultural sort of and how do you say it? Agricultural. What do you call it? So more hygiene in the way you do your farming, so you don't have to use antimicrobials to reduce disease. So I think it's still a very complex subject. I don't have a full answer, but I think it's multi-tiered at international, national, and subnational level to take it on, and has a very strong community awareness and social interaction in order to remove that problem.
Right. So you're saying that there's actually this another space for intervention, which is really addressing the root causes at the community level. Why are these One Health threats, whether they're AMR or other NTDs, emanating? And we need to find those behaviors and really try to raise awareness, provide alternative in sources of livelihood, etc. And then you also spoke about the importance of communication. When you said AMR is invisible, I think that is also a critical part of better governance for One Health. Are we able to actually communicate not just the risks, but also the opportunities of One Health action to policymakers and the public alike? And I think that is also something that will need to be enhanced. Again, the communication aspect. Anna and Eric, do you have any additional examples or comments related to the role of communities or local or One Health governance at the local level?
I'll happily say something there, just to pick up a bit on what Bernadette was saying. We've seen during COVID, if we were to permanently close all restaurants and hospitality venues around the world, there would be a riot or many riots if we didn't provide alternative sources of income or for the people who ran those businesses. Okay, and it's exactly the same with the AMR issue. There are whole groups of people in privatized veterinary services whose income is derived from selling antimicrobial drugs to farmers. So if we want to move away from the use of those antimicrobial drugs, we can't just ban it and expect those people to find a different job the next day. We have to provide those kinds of alternatives, maybe through training of those individuals, for example, rather than selling drugs as the main means of making money, or selling advice on better husbandry to the farmers, for example. So repurposing the skills that they already have and moving them into a slightly different slightly different direction. And that kind of thing doesn't happen overnight. It takes time, and it requires governance from at all levels, from national level, local, regional, and so on. And it's really about the having a focus on ensuring that there's a common interest between them and the people who are trying to impose policy, and structures that will facilitate the implementation of those common interests as they go through. So really supporting what Bernadette was saying, and what we, I guess in many ways, what we would have before us in a situation like that is a fantastic workforce whose ability to deliver services could simply be slightly reorientated to delivering something in a slightly different way, which would then achieve multiple objectives. Yeah.
Thank you, Eric. Anna, do you have anything to add?
No, not really. I mean, just to really echo though and emphasize, I mean, it gets back to my comment previously around, again, what are public goods and private goods in these, say, take the community-based animal health worker systems, for example. And as Eric said, you know, what are the incentive-based policies that we can think of, or the pull factors that can help, you know, we all sort of, you know, worry about the lack of public services, disease surveillance, reporting, all these sorts of things on the ground. But at the same time, we say, well, you know, we worry also about the amount of drugs and stuff getting sold. So how do we shift the focus and provide those incentives both to farmers and to governments, I guess, to say, well, okay, how can we reward these private actors by performing what are public goods? So we get the information we need. Farmers are happy to have people on their farms and happy for samples to be taken and all these sorts of things. So thinking of the whole system, and this is where we haven't touched on it yet, but, you know, trade and you know, the pools in terms of animal biosecurity, for example, the pools that formalised trade can make as well to try and incentivise everyone in that system to actually move towards a higher biosecurity status is a really sort of, you know, interesting sort of area that again is probably another webinar.
I saw Bernadette. One
Just
quick comment.
And one brief comment, and just to bring also the conversation from before, corporate companies could also very much support the awareness raising around these issues. They could have a role to change behaviors, to change also the value chains within the antimicrobial the value chain. So they also have a role. It's not just communities and public sector. It's really also bringing in pharma who are often quite open to looking at innovative ways of engaging with their potential clients in the future, you know. So just wanted to add that.
Thank you, Bernadette. So I just realized we only have 7 minutes remaining. Time flies so fast. And, you know, talking about governance requires, you know, maybe a conference in itself. And so we'll just do the last round of questions, and, you know, we'll wrap up with your concluding statements. You know, we have a question here from Mahmoud Ali Umar. He's from Nigeria, working on schistosomiasis in poor rural communities. Given the lack of political will from the leadership, what advice will you give on both sides? And I guess, you know, he's referring to both policymakers and the communities to improve on NTD research to achieve elimination. So, you know, and maybe Bernadette being at the heart of NTD governance in WHO, you might want to, you know, start any advice how we can accelerate the NTD elimination agenda in countries, but also, you know, maybe expand it and include all the other diseases under the One Health umbrella. Bernadette?
Just briefly, I mean, political will is something that we all are seeking to increase, especially around those invisible or neglected. Why the name neglected? So it is a big issue, but we've made progress with the support of the large community, and they help build that advocacy around. In fact, the Minister of Nigeria spoke on the WHO webinar yesterday around partnerships for reaching the NTD roadmaps, and that for us is a start of the leadership in acknowledging a problem around the 20 neglected tropical diseases. I'm not only talking about schisto, to already have that sort of acknowledgement. But then after that acknowledgement, we need to have the NTDs embedded inside their national program, inside the budgeting, and that that local governments are also empowered to be able to implement the programs, because at the end it's not the national government doing this work. So it is a very complex system, and I think one big area where I think communities need to raise their voice as well and demand for services. And I think so it is a two-way system. Around the research, I'll give it to Anna and to Eric to respond to, but I think the research is very valuable to understand the context and to improve and refine the programs in the area. But I think there's very well established programs on schistosomiasis, and already with very little additional research, they could be rolled out rather efficiently. Thank you.
Okay, so we only have 4 minutes remaining, and I'll just put the last question from Michael. It's about sustainability. You know, you mentioned, Bernadette, the problem is always, you know, there's a crisis, we talk about it, and then the issue dies down. I remember there's a World Bank report entitled From Panic to Neglect. And so how can we make sure that after COVID, you know, we don't go back to the state of neglect, and instead really serious and long-term commitment to One Health governance and implementation and research to address not just this pandemic, but all the other future One Health threats that we will be facing, unfortunately, in this century. So, you know, I'll ask you for like one-liners, and I know it's difficult. And so maybe I can start with Anna.
Thanks, Renzo. I mean, really important question, and it's something at the core of all of us working in this space. I think, you know, sustainability is the thing that must be there before things can move forwards. You know, we haven't talked about in this forum as much because it's more an underlying principle of One Health more generally, not just in the governance space, but, you know, really demonstrating this value addition of sectors working together and, you know, building on, you know, from the previous example of schistosomiasis, what else can we build into those interventions to demonstrate this value add in working in this One Health space? And I think I think Bernadette and Eric would agree that, you know, for many years we're seeing this evolution now of it becoming more ingrained in One Health and sustainability, particularly in the NTD space. So I think, you know, we're moving forwards, and I think there's many brilliant examples, and we just need to keep moving, I think.
How about you, Eric?
So yes, to ensure that we don't lose a momentum that we maybe are starting to get here, I think actually I want to come back again to the local level of things. I think at an international level, that momentum won't get lost so quickly, and it'll be possibly even easier to maintain that momentum than it might be elsewhere. But at a local level, when all the priorities suddenly move on to other things, I think really demonstrating that between individuals there is an added value of keeping the focus on issues in this way. And I think we consistently have to be convincing that there is value added in doing it, in maintaining that unified, multidisciplinary, interdisciplinary focus between institutions at all levels. And it starts at the local level. If operators in the community or in the really extreme level of local government don't see the value of working with their colleague in the office next door or whatever, then it's not going to happen practically ever. And so ensuring that that value is seen by those people, and that when they see that value and act on that value, there is a reward, I don't necessarily mean a financial reward, but a reward for doing things in that way that then leads to better things in the future, I think is important. So keeping the focus at all levels, but especially at the local level, to ensure that that the emphasis is always there.
Thank you, Eric. And Bernadette?
Just very briefly, I think we need to walk the talk ourselves. As institutions, as partners, as stakeholders, we need to collaborate, be transparent about what we do, share share the information, the data, so we have a pooled information to set our decisions on, and most importantly, measure what we are doing and how we are changing the world and the impact we are having with this joint collaboration. That's it.
Thank you, Bernadette. Thank you, Anna. Thank you, Eric. Unfortunately, that's all the time we got, but we have some seeds that are being planted. Let them germinate. I hope that this is not the end, and surely this will not be the end of this continuing conversation. Please visit the website of the Lancet One Health Commission at the University of Oslo's website for future updates. Thank you for joining us. Please remain healthy and safe, and see you at our next webinar. Goodbye.